morning, and welcome to the Ombudsman program. My name is Diane Wellborn. I am the Ombudsman, and I'm going to be your host for this evening's program. I'm really delighted to have with me tonight two representatives from our local federally healthcare center, Five Rivers Health Center. I have been pleased to serve on the board of this wonderful organization since its beginning, and I'm very happy to bring to the viewers tonight the CEO of Five Rivers Health Center, Gina McFarlane-El. Thank you for joining us tonight.
Thank you for inviting us.
Great. And also the Director of Marketing and Communications, Kim Bromlage, is here to help answer some questions. This health center is located in several spots around our community, and I'm going to come back and show you some pictures of those so viewers can recognize when they're in the area of a Five Rivers center. And we also are going to take questions from viewers this evening. So if you have a question about any services or anything about the health center, feel free to call in and give us your question and we'll get it answered. And the number is on the screen for any viewers to call. So I'd like to start and ask Gina a couple of questions, and if we could have the slide of the Five Rivers logo, that might be a very good way for us to start with that. Why don't you tell the viewers our story at Five Rivers, okay, so they know how we got started and how all of this began.
Well, thank you for inviting us again tonight. So Five Rivers Health Center started with originally 3 residency clinics that were a part of Good Samaritan Hospital and Miami Valley Hospital, our family medicine, internal medicine, and OBGYN centers. And so what we wanted to do was to break away from the hospital with the hopes of becoming a federally qualified health center. And part of the rationale of doing that is that it would allow us to see more patients, to also have the opportunity to receive federal funding. And so that happened May 23rd, 2011, and so we are going into our 8th year of being a 501c nonprofit organization. It also allowed us the opportunity to expand from those original 3 sites to 9 sites. And so Kim will talk a little bit more about that on some of the locations. But it gave us the opportunity not to just expand sites, but expand services. And so if you think about your physician's office that you go to, we're a lot different. We provide medical care, behavioral health services, we have dental care, we have substance abuse services, we have a dietitian, we have a pharmacist. And so the goal is to be a one-stop shop for patients. And for a lot of our patients who are on Medicaid or uninsured, it's hard to get around to all of those different places. And so being within the neighborhood allows us to provide all of the services they need at one of our locations.
Fantastic. Thank you very much. I'd like to have the next slide, please. I believe this one is going to let us talk a little bit about the mission of Five Rivers, which we've covered when the next slide can come up. I'll let you go ahead and start on the mission. Every agency has a mission. This is the history that the viewers are seeing now, and it is highlighting for the viewers that 70 original employees are the ones that came together and named the facility Five Rivers Health Center. Yeah.
Absolutely. And so as you see, we're committed to providing access to quality, comprehensive, respectful care for our patients in the community. And what our employees did was we had a contest. And the contest was who can come up with the best name for this new organization. And often we try to do things where we involve our employees because, you know, I'm just one person, but when you get 70 or 70 some people in a room, they can come up with a better answer. And so it was Jan out of MedSurg Health Center who came up with the name, and that was the name that we all loved.
Good, good. And which the logo is all about, and speaks to all of that. That's wonderful. I'd like, please, for the staff here at DATV to put up the first location that we're going to talk about tonight, which is the one at the Family Health Center on Philadelphia Drive. So why don't you say a little bit about that center and how it came to be and what kind of services you all provide there.
Okay, well, that's our newest and most up-to-date location, and we've been in that building for about 3 years. It is a family health center, so we see patients of all ages, newborns to senior citizens, and it's a great location. We are directly across from the former Good Sam Hospital at Salem in Philadelphia. We also have our administrative offices there, so the things that Gina and I do and the other administrative staff are also located at that facility. But people can come there for, as Gina mentioned, the one-stop shop. So we have a behavioral health specialist there. We have pharmacists that visit that location. So they can come there for all of their medical needs, really.
Okay. I'd like to let the viewers know if they do not have a place where they're receiving services and they are in the northwest area of Dayton, they can certainly approach this particular facility because it's close. And maybe you could tell us how a new patient, what's the best way for them to come to you all?
Sure. The best way, really, we're accepting new patients at all of our locations, but the best way is to call us and schedule a first appointment. And we'll get a little basic information over the phone, but then they can come in for their first appointment and fill out some paperwork. So it's just like any other doctor's office, but we are accepting new patients, and we welcome folks that can come to us. Whether they have insurance or not, we will accept them as new patients.
So Medicaid, Medicare, no insurance at all, or some private insurance are all accepted?
That's correct.
Okay, very good. And the phone number is?
208-8585.
Okay. For viewers, we will have that on the screen again later so that individuals who didn't have a pencil handy can get that number down if they wish to call and become a patient at that particular site of Five Rivers. The next site we're going to describe to the viewers is the Medical Surgical Health Center. And so if we could have that slide so people can, the viewers can see exactly, perfect, that's what we're looking for. So maybe you can say a little bit about what happens at the Medical Surgical Center.
Well, it is what we consider internal medicine. So medical surgical is a little confusing sometimes to people when they hear that. They're not quite sure what that means. But it's specialty care in addition to regular primary care. So, folks, we have doctors that are seeing patients, providers that are seeing patients who are dealing with cancer, who are, need oncology kinds of services. We also have infectious disease specialty clinic kind of things. And so that's all taken care of. And it's at Ludlow Street. It's very convenient, right downtown.
And that site is also the home for our in-house pharmacy too as well. And one of the things another reason why we wanted to become a federally qualified health center, it allows our patients to receive what are called 340B pharmacy discounts. So just in the spectrum of pharmacy care, if you have no insurance, you're going to pay, let's just say $100. If you have 340B, it's probably going to be close to about $5. And so for
an enormous difference.
An enormous difference. And so it really allows our patients who are uninsured or have limited benefits to get medications at a reduced rate. And
those are available to patients at any of the sites we're going to be presenting tonight.
Absolutely.
Regardless of the insurance that they're carrying.
And regardless of their ability to pay or where they live. One of the things that our pharmacy has been able to do is to provide free pharmacy delivery service. And so we're delivering medications to patients in both the Montgomery County as well as the Greene County areas too as well. And it's free for the patients.
That's wonderful. That's a really great asset. The next site of the Five Rivers Health Center is the Center for Women's Health and Pediatrics. So we'd like to see the front door of that facility. There it is.
Yes.
I'll come back to you, Kim.
A lot of folks are very familiar with that facility. They think of the Barry Women's Health Center attached to that side of Miami Valley Hospital. And so we have both our Center for Women's Health and Pediatrics there in one location, separated, you know, as you enter the building. And we see patients who are newborns, we see pregnant moms, we have a variety of care happening at that location.
Okay, wonderful. That's great. And then next, and not last, because we have a number of sites here, the next one is the Dental Center, and this is located in
Go ahead.
30 Apple Street.
30 Apples.
In the lower level area, and we have a residency program there too as well through the Miami Valley Hospital, and we have 2 dental hygienists who will provide dental cleanings, and then we have 7 dental residents who will provide comprehensive dental care. And so we do dentures, we do bridges, we do crowns, we do fillings, and we do extractions too as well.
Okay, and it is the same insurances across all, so that would include the dental, no matter whether it's Medicare, Medicaid, private, or no insurance.
Yes, and what we probably failed to mention is that for people who have no insurance, we do offer what's called a sliding fee scale, and that allows patients to pay based upon their ability to pay and the income that they're making. And so all of the sites have a sliding fee scale.
Okay, very good. That's very good to get out there so people can understand that. And then we want to see and talk about the Samaritan Healthcare Center. That one's next.
Yes,
Okay.
and previously, until last month or so, it was referred to as the Samaritan Homeless Clinic. But we do so much more than just provide health care and dental care to individuals who are homeless or at risk of being homeless. And so, again, it's a wraparound care type of facility. And individuals in need can make an appointment and come there for a variety of services. It is located there on Edwin C. Moses at the end of the job center, kind of next to the St. Vincent thrift store.
Right in that complex there.
And just to add about the Samaritan Health Center, they are actually the first federally qualified health center within Montgomery County. And so they've kind of been the model that we've wanted to do with all of our sites. And so besides medical and dental, they also offer vision. They have a cooking classes for patients too as well. They provide clothing. They have a respite care site too as well, a respite apartments for patients who can't stay in the shelter area. So when we grow up, all of the other sites, when we grow up, we want to be like the Samaritan Health Center.
Okay, and you're stressing that because it's co-locating all of the services so that if an individual needs something, it's all going to be there. Maybe not every day, but it's there at that facility for them to come to.
Absolutely. And we just recently started offering what are called medication assistant therapy or MAT services for patients who have an addiction to opioids or alcohol. And so we're proud to be the first FQHC within this area offering that service too as well.
That's
primarily Vivitrol services and counseling.
Good. And individuals who want to access those services, is it the same procedure as up on Philadelphia Drive? They just call and make an appointment, and appointments are available, and you're taking patients there as well as all.
Absolutely. Their telephone number is a little bit different. It's 461-1376.
Okay.
And that all of this information is found on our website, www.5rivershealthcenters.org.
Good. Thank you for giving that. That's wonderful. All right, the next site that we want to talk about is the most recent expansion into Greene County. So we have a Greene County site we would like for the viewers to see the front of.
Yes, and Greene County, we're proud to say, just did their grand opening in their new facility. It's in combination with Greene County Public Health. So we have one side of the building, and the public health folks are on the other side of the building. It's a wonderful new facility. Again, medical, dental, behavioral health, all those same services that we offer to all of our patients available in Greene County.
Okay, and that's really exciting about that, to have a brand new place and a brand new opening. And then last but not least is Star Pediatrics, and that is also located in Greene County, correct?
Sure, and it's also located in Xenia, and we have the pleasure of working with Dr. Hess and Dr. Triplett and their staff that are now part of the Five Rivers family.
Okay.
So there's one other group we forgot to mention.
We don't want to leave anybody out.
No, we do not. And that is, we have the pleasure of now working with the dental sealant program. And dental sealants, there's a team of 2 dental hygienists and 2 assistants who go into over 47 different schools within Montgomery County, as well as Clark County, as well as Greene, I forgot about Greene, and Madison counties, to provide free dental sealants for students in those schools. And they've been doing this service for over 25 years, and we've had the pleasure of them joining our team too as well this summer.
Oh, that's fantastic. Really good news there. I understand that occasionally you have friendly competitions among all of these different sites that help to boost morale and to help highlight when one facility is highly performing in one service or another. Would you like to tell the viewers a little bit about that?
So we have a couple of different things. One of the things that we do is we actually have an incentive for a Garmin. Okay. And so we're actually doing this with our patients as well as with our employees. And so one of the things we're trying to do is to walk as many steps as possible. We keep encouraging our patients to get healthy, and we need to be just as healthy as our patients. And so every month we try to see who's going to be number 1 or 2 or 3. I'm not always in that top tier, but I have grand hopes one day I'll be in that group. But we also have competitions with regards to performing quality measurements. All of our quality information is on the public domain of HRSA.gov, and our goal is for each team to exceed Healthy People 2020 guidelines. And overall, Five Rivers has been able to accomplish some of them, but we'd like to accomplish even more. But each site can see how each one is doing.
I see. So great. I'm glad you're doing that, and I think it's probably helping incentivize a lot of the employees. So that's good. There's something else very unique about Five Rivers Health Center, and that is their relationship to our local medical school. And perhaps you'd like to explain to the viewers exactly what that means for both the staff at Five Rivers and for the patients at Five Rivers.
So as I mentioned before, we have residency programs that work within Five Rivers. And so the Wright State University Boonshoff School of Medicine's residency programs, the family medicine, OBGYN, internal medicine, dental is part of the Miami Valley Hospital. Their fellowship programs for hematology, infectious disease, and general surgery. We are the site where all of those residents, and so it's over 200 of them, come to our sites to serve patients. And so the relationship that we have with them has become very robust over the years. And without them, there's no way that we could serve the over 26,000 patients that we serve. And we're happy to have this great partnership with them. And the care that the residents provide is top-notch. And we are glad to be associated with them.
That's wonderful. So how long are they with the centers, all of the ones that we highlighted here, all of the different sites within Five Rivers?
So the family medicine residents are at our locations for 3 years, as well as the internal medicine residents. The OBGYN residents are there for 4 years. The surgery residents are there for 5 years, sometimes 6, if they're doing a fellowship. And the HEMOC fellows are there for 3 years. And so, I'm sorry, hematology, oncology fellows are there for 3 years. And so it gives them a great opportunity to interact with patients. It gives them a great opportunity to really get to know what's going on in the community.
Is this program with involving the residents and giving them the experience that's required for the residency, is this unique to Five Rivers Health Center?
So for most federally qualified health centers, they don't have residents that are a part of their scope. Some may have 2 or 3. Within Dayton, we have the largest number of residents that work in a federally qualified health center. So we're number 1 in the nation from that perspective.
A sheer number.
Sheer number of residents. And it also gives them an opportunity to really see if working in an underserved community is something they want to do for the future too as well. We're lucky that those residents are employees of Miami Valley Hospital, and so it allows them to receive some of the resources that Miami Valley Hospital has too as well. And so they do all of their inpatient care at Miami Valley Hospital, and they do their ambulatory rotations with us.
Okay, very good. Is there anything else to add there?
No, I think that people occasionally hear that we have residents and they think that means that person's not a doctor yet, but they have graduated from med school and they're required to do their residency. And so while they're seeing patients, they do have what we call preceptors and faculty that are supervising them and counseling them and working with them as they are seeing patients. And quite frankly, building a really nice relationship with patients in their practice.
And many patients like that setting because this gives them an opportunity to actually train residents for the future. And so, not only are patients learning from the residents, but the residents are also learning from patients.
Right. Good. Well, thank you for highlighting that. We hear a lot of talk now about a patient-centered medical home, and I'm not sure that all of us fully understand what that patient-centered medical home is. Would you like to offer a comprehensive explanation so that viewers who leave this program will understand what that is and how to get it?
So there's a whole movement that's looking at the whole fact that the whole medical system is really geared around the provider, around the physician, around the nurse practitioner. And I want to say almost about 10 years ago, there was a movement to say we really need to shift that to being patient-focused versus provider-focused. And so patient-centered medical home looks at making that whole transformation. And so in order to be considered a patient-centered medical home, you can receive that accreditation through about 3 different organizations. And we've done that at all of our, I want to say at 4 of our sites. Through the National Council for Quality Assurance, or NCQA. You have the opportunity to be a level 1, a level 2, or a level 3. You have to complete, I want to say, close to a 500-page application in order to do this. You have to prove that you truly are patient-centered. So it means that patients have the opportunity to have a same-day appointment. When you're sick today. You're not sick 2 weeks from today. And so having ready access to services is very important. Having access to a computer where you can contact your provider and not have to make a phone call. Having access to laboratory results. Making sure that your information is being shared with your next provider. If you have a consult or other services. So I'm only mentioning about 4 or 5, but there are over 100 different measurements that you have to meet in order to be considered a patient-centered medical home. And to be at the super top of that, you have to meet at least 95 out of 100. And I'm proud to say that Five Rivers Health Center has done that. So we're a level 3 patient-centered medical home at 4 of our locations. There are very few physicians' offices within the Montgomery County and Greene County area that have that distinction. I'm proud to say that we have that.
Wonderful. Anything else to add?
Well, and I think too the idea of patient-centered, if you think of a wheel, and rather than the provider being at the center or the hub, the patient is at the center. And so you may have a pharmacist and a provider and a social worker and a dietitian, and they're all working in conjunction with each other to make sure that that patient is the center of focus. And they're all working together in addition to the patient to make sure that they're, doing what's best for that patient's well-being.
Okay.
And we've learned a lot about just how valuable the input is that a patient could give. As a part of being a federally qualified health center, 51% of our board has to be patients. And so we've had the wonderful experience over the past 7 going on 8 years of patients giving us input of things we're doing right and things we're doing wrong. And they have helped us improve our call center. They have shared services that they would like for us to do. We've added acupuncture services, was something that we would have never thought of. But again, one of the patients that's a part of our board shared with us that, hey, we need to look at other things versus just traditional medical care. And so the voice of the patient is definitely heard loud and clear.
Good. Well, thank you very much. So now individuals who may want to become patients of Five Rivers, well, now they've heard what they can expect when they enter and how that may feel different than previous offices they've visited before, if it's a patient-centered medical home. Let's move to talk a little bit about the centering pregnancy portion of the or provided by Five Rivers Health Center. And I think we have 2 slides that feature the centering pregnancy in action that we might want to put up for the viewers now. Why don't you tell us what this is?
Well, it's different than traditional prenatal care for a pregnant woman, and it's much more focused on group kind of care. And so we found, and studies have been done that show that women who go through this type of prenatal care before they have their baby are much more successful in all kinds of things, higher birth weight babies and lower infant mortality rates and those kinds of things that we want to focus on. And so moms-to-be and their support person or their spouse or their partner come to the sessions and they see their provider. They're at the group session, and then they work with all the other moms that are due about the same time as they are. So they talk about common concerns or questions. There'll be topics that they'll discuss at each centering pregnancy session. And then, of course, they'll get to hear the baby's heartbeat and that kind of thing. But it's much more group care than it is just coming in and seeing your provider, listening for the heartbeat, and then the provider says, do you have any questions? And you as a soon-to-be mom might not even know what questions you have. But when you get together with other moms-to-be, you can start to bounce ideas off and concerns and talk about those kinds of things. There's refreshments, siblings are allowed to come to the sessions, and incentives they can earn. So it's just a really different approach to prenatal care.
And how long has this been offered at Five Rivers?
We've been doing it since 2015 now.
Okay.
So we're going into our 4th year. And patients also have the opportunity to take their own blood pressure. They learn how to take their own blood pressure. They take their own weight. They're helping each other as they go through this whole prenatal cycle.
Okay. And what, you mentioned a few, but are there other specific benefits of this centering pregnancy that you would want to stop and highlight now, given what the Dayton community and the struggles we have with infant mortality rate? So
as Kim mentioned, it has improved, reduced the infant mortality rate. We've increased the number of women who breastfeed. We have been able to reduce the number of women who smoke during their pregnancy. Because a lot of the women are coaching each other during these sessions, and so you have that wonderful peer pressure at times to help people and guide them of what's the right thing to do. We've been able to see a significant number of women who have increased their relationships with their partners too as well.
Excellent.
So all of those things help to create a really good setting for the women who are pregnant.
That's good to know. All right, I'm being told that we have a caller on the line that would like to take part. So caller, you're on the air. We'd like to hear your question.
Thank you. Thank you for this excellent program. I'm a resident of the general area of the former Good Samaritan Hospital, and I'm grateful that Five Rivers is still continuing to provide health service for our neighborhood. My question has to do with services that are not provided, and so I'm wondering about prenatal care. Is that provided by Five Rivers? And when I was shoveling my driveway this weekend, it occurred to me, what about emergency care? If someone in the general neighborhood of the former Good Samaritan and Five Rivers were to have a heart attack shoveling snow, could they be taken to Five Rivers for the kind of emergency medicine that would stabilize that person before they are transported to Grandview or Kettering or wherever else they would have to go? Thank you for answering my question.
Thank you for your question, and we will get you an answer here. We were just speaking about centering pregnancy, which may have triggered our caller to think about birthing services, because we didn't state specifically anything to do with that. But I think you probably heard. Did you hear his question?
Absolutely.
Good. Okay, I'll let you take it then.
So we do not provide birthing services, nor do we provide emergency room services. As a federally qualified health center, within the scope of what we can provide, we're considered more of a patient-centered medical home. And so we do more continuously ongoing medical home care versus episodic care. And so unfortunately, patients in the Good Samaritan Hospital area would have to visit Miami Valley Hospital if there was a birth to occur, and they can go to both Grandview as well as Miami Valley Hospital for emergency room services.
Okay. And if a woman is going to deliver in the centering pregnancy, do women then choose which hospital they're going to deliver, and do they visit and see the hospital? Is that like a part of that centering pregnancy?
Absolutely. And so the centering pregnancy, even though we're saying it's centering pregnancy, it is the prenatal care that the mom is receiving. And so patients will visit Miami Valley Hospital. Grandview does not provide any delivery services, but Miami Valley Hospital does. And so we'll actually do kind of like a field trip to go upstairs to see the birthing center. And we've done it for both patients at Family Health Center as well as patients at the Center for Women's Health.
Okay. All right. So that component is in there. Is there anything else you'd like to add in response to that question?
We too are saddened by Good Samaritan Hospital closing, but we'll talk a little bit in a moment about some of the things that we're doing to try to fill some of that hole.
Okay, yes, we will then, we will come back to that. I'd also like to ask you to say a little bit about what you all are calling the Global Health Clinic services. And so why don't you describe how those services can help people who are newer to our community?
So many of you know that Dayton is considered a welcome city, and we have that wonderful distinction. At the same time, many of the families that come to us as refugees, they've been in some of these refugee camps, not for a year, but sometimes 4, 5, or even 10 years. And so they may have a lot of health concerns that were not addressed. And so the Global Health Clinic allows us to see the entire family together. And so Family Health Center, again, which is located across from Good Samaritan Hospital, just started offering this particular clinic in conjunction with the Public Health Department and Catholic Social Services, where we will see the entire family. So the goal is to check them out from head to toe, but to then provide overall medical home services for them. And so instead of those refugees trying to find out which doctor, well, one person will see the child, but someone else will see the father or the mother, we're trying to keep that whole family together to do truly wholesome family care. And so once we check them out, then we make sure that all of those patients are seen at that family health center. And so instead of having to go to 7 different appointments, they can just go to 1 appointment. And it's been wonderful for the families, and it's been wonderful for our staff to realize how fortunate we are to live in the United States. And the fact that we are citizens here and we are able to receive health care, many people around the world are not as privileged as we are.
Good, thank you.
The other nice service that we have that comes into play, not just for these patients that may have come from another country, but may have lived in the Dayton area for some time, but don't necessarily speak English as their first language.
Right.
We offer interpretation and translation services. So 49 different languages. If someone comes in and needs some assistance in that regard, we can provide that so that they don't have to feel like there's a communication gap between the patient and the provider, or even the person who's assisting them at the check-in window. We can provide that.
Good, that's good to know. Thank you very much.
Our top languages are Spanish, Arabic, Kenya Rwandan, and Russian Turkish.
Very interesting, yes. Good. So you're getting the translation services to bring right in so
Yes.
that all of the providers can then use that and the family can clearly understand. Yeah,
Yes.
That's excellent, very good. Okay, Thrive. I think we have a slide that shows the logo of Thrive, or the representation of Thrive. But Thrive is a relatively new program with you all, but I'll let you all say a little bit more about that.
Well, when the announcement came that Good Sam was closing, as Gina usually does, she says we're going to make lemonade out of the lemons we've been given. And so we actually talked to neighbors in the 45406 and surrounding community, those folks that live in the impacted areas. And what they said was they would really like to have some assistance with ongoing kind of medical and health related issues and challenges. And so the fact that we partner already with Wright State University and their School of Medicine was a natural fit for us to then work with medical students, train them to become health coaches in our 45406 zip code. So that's what Thrive is, a health coaching program for neighbors in our surrounding area. And so far, we've got a lot of interest in the program. We have a lot of neighbors who have said, yes, I would love to sign up, come in on a regular basis, and talk to one of the health coaches about various issues. You don't have to be a patient of Five Rivers, but what we hope is that neighbors who don't already have a primary care provider, we can help them get one, whether it be our staff and our providers or someone else. But that way they are addressing their health concerns and they're actually working with someone to help them make more positive choices as far as healthcare goes.
Good. I have a couple of follow-up questions, but I'd like to ask if we could put up the slide that shows first the training that the coaches are being provided, and then secondly the coaches as a group all together in their T-shirts ready to
Yes,
go
they
out.
are.
They're they ready to go out? I think the viewers are seeing them now, so it looks
Yes.
like you have about 40 maybe.
There's
Emma?
almost 50 students,
okay.
yes.
50 that are involved in this. And are these residents as well?
No, these are first and second year medical students.
Okay.
So they are just getting started on their medical training and education. And we had a wonderful response from those students saying that they really wanted to provide assistance in a variety of areas to neighbors who said, yeah, I really could use some help.
So, for example, if a neighbor is wanting to improve blood pressure, and get it down. They could meet with one of the health coaches, and some program can be designed, tailored for that person. So this is almost like a personal trainer. I mean.
It is because
Okay.
those health coaches have a variety of resources available to them to then talk to the neighbor about. What kind of issues are you having? Are you not getting enough exercise? Is it the diet that's a challenge? And so they can work together on the different aspects of their medical concerns. And hopefully we can make a positive impact for that person.
What do you anticipate are the top items that people are wanting to improve? Well, I mean, it is right after Christmas, so most people are wanting weight reduction of some kind. But what else would you say this program is perfectly designed to help with?
Obesity, hypertension, diabetes, just engaging in a conversation on what you can potentially do to impact your health. And I think one of the things Kim forgot to mention, this program is free to anyone in the community. The goal is to get people to be engaged in their health.
All right. Good luck. And as the weather warms, maybe we'll see some more.
Right. One of the first things that we decided to try was walking Wednesdays.
Okay.
You know, it's simple, it's easy, and so we have some neighbors that come over to our Family Health Center location on Wednesdays, and if they can only walk from our front door to the edge of the parking lot or a couple of times around our conference room, that's fine. That's better than what they were doing before, and they really seem motivated to make some positive changes and be involved in their own lifestyle choices and decisions that they're making for their health.
And so we'll be adding other programs along the way. We'll be doing some cooking demonstrations. We'll also have some free exercise classes. So all of the programs under Thrive will be free for our neighbors in the 45406 area.
Okay. And I guess I should ask also, because many people may, is parking free as well?
Absolutely.
To come to the facility to visit.
There's a gate, but it comes right up, and it'll come right up when you leave too as well.
Okay, so there no money is involved to get
That's
out
right.
that gate. You can
Correct.
just come and go. That's great. I know that you've done a number of needs assessments that are a part of ongoing grant writing and then ongoing monitoring agencies. What would you like to share with our viewers about the more recent needs assessments for our community?
So we conducted two needs assessment. One assessment for the Montgomery County and Greene County areas, and another for Miami County too as well. And some of the things that we heard from our neighbors through some of the focus groups, we also had patients fill out information too as well. The things that they were most focused on were obesity, hypertension, diabetes, asthma, the infant mortality rate, accessibility for services. Can you remember some of the other things?
Well, and you mentioned accessibility. What we found was there's a lot of challenges for people to just get transportation to get to their primary care doctor. And so that prevents a lot of people from going to see their doctor or their provider because they don't have a way, or it's a decision between having to go to work and going for their appointment, and they have one bus token left. And so they've got to make the decision on which they do.
And I'm proud to say that Five Rivers, through some of the grants that we've received over the past couple of years, has been able to provide Uber Health for some of our patients, bus tokens. We're working on bus passes for some of our pregnant women too as well. And so again, hearing the needs of what some of the community members said gives us ideas, and it gives us fuel to figure out what are we going to do for the future.
And what can these needs assessments can drive them, what services are provided and offered. Some of these that are constantly mentioned, the obesity, hypertension, diabetes, these are these are difficult challenges for people. Would you like to comment any more? I mean, they keep coming up in like the top cluster of issues. Are they in the top cluster all across the nation? Are we significantly different than our counterparts? Or
I would say it's similar to what most sites are seeing across the nation. I would say the one thing that makes Montgomery County a little bit different is that we have a pretty high rate of people who still continue to use tobacco products. But for us, as a part of Five Rivers, the goal is to, again, engage that patient, to make sure that they understand what's going on, the implications. And so we've created several different programs to address all of those issues. So I mentioned a little bit about the Garmin Project that we had. And so we actually started with our patients. So we provided free Garmins to about 100 patients who are hypertensive or diabetic. And we gave them the opportunity to do a step challenge, to really try to, change some of their behavior. And so those particular patients who participated every month, as long as they met a certain number of steps, were eligible for a $100 gift card to Kroger's or $100 gift cards for their GP&L voucher. And so again, it gave patients the opportunity to be engaged in their services. Kim, do you want to talk a little bit about the diabetic program?
Right, so we actually offered then a diabetes management program to our patients who were really having trouble managing their diabetes. And they could come in for free walk-in clinic on first Wednesday of every month, and they get to meet with the dietitian and the pharmacist and a provider. Check at their numbers, talk about, what has been happening in the last month that you've been challenged with. And so we're working more one-on-one with patients and providing them that extra personal care to say, this is really an issue, so what do we need to do to help you get more steps in every day? Or are there smoking cessation, opportunities for you? All of those kinds of things. And again, it's one-on-one, it's more personalized care.
And through these programs, especially for our diabetic patients, we feel like we've made the biggest impact, especially those patients who have done the STEP programs. They've been able to bring their hemoglobin A1C, one of the major things that we test at least every 90 days, down to a reasonable level. And so we know there's more work to be done, and we'll continue to work with our patients and engage them for better health.
All right. Well, good luck with all of that. We did talk already a little bit about having your own pharmacy within Five Rivers and the benefit that gives to patients for the cost of obtaining their needed prescriptions. Has it brought any other kind of synergy to the staff or employees, or has it had any other additional impact?
For a lot of patients, especially the patients who were uninsured or continue to be uninsured and have gone to other providers and they've come to us, we often hear from many of them, I used to pay $200 for this medication. It's only going to cost me $10. I can't believe it. And so again, as Kim had mentioned, for a lot of patients, they have the choice of food and shelter versus paying for their medications. And so hopefully we're able to keep them well and to keep them healthy and to get them back on the road to recovery.
I think too, I would like to add the fact that it's not common, I don't think, for individuals who go to another primary care provider to have access to the pharmacist right there. So, we have patients that come to our family health center for a regular checkup or an appointment, and the pharmacist that day can actually go in and talk to the patient and do some medication management. What are you taking? Let's make sure that everything doesn't have a bad interaction kind of issue. And so, again, that personalized care, patient-centered care, incorporating the pharmacist into it is really different and unique.
Mm-hmm. It is. Have you noticed any additional benefits that you may want to talk about having this person-centered care model. Have you had to change provider attitudes very much in this? I mean, because people are now on a team rather than a solo doing this. It becomes more of a team effort for that.
I think it was when we started this journey a couple years ago. I think for some of the providers, when we started saying, hey, this really has to be what the patient wants versus what you want, it was kind of like a switch in, oh, yeah, it is about the patient. And so by working with the residents and working with our own providers, they have slowly made that transition. But there's always room for improvement.
Okay. And then before we run out of time, I wanted to ask if there are additional changes that Five Rivers has incorporated or future plans that Five Rivers has in response to the closing of Good Sam.
We'll continue to expand the transportation services that we've had. We've mentioned that we've added centering pregnancy at Family Health Center. We also have our midwives as well as the family medicine residents as well as their faculty members who now provide deliveries at Miami Valley Hospital for those moms who are pregnant. We'll continue to look at making sure people realize that prenatal care is available. We've done some billboards within the community to let people know that Five Rivers is available for prenatal care. Thrive will continue to expand in this upcoming year.
And I think it's important for people that are still concerned and sad about the hospital closure to realize that we are in the business actually of keeping people out of the hospital. Our goal is to make sure that patients have a relationship with their provider and the whole team, and that if they're coming to the office on a regular basis and managing and maintaining their health, then hopefully they're not needing an urgent care or an ER. We'd like to make sure that they don't look at that as their first choice for health care, that they really make a relationship with their primary care provider.
Good point, thank you. Again, we have very little time left now, but I'd like to give you a chance for any particular closing thoughts that you would like to share with the viewers, maybe something that you want to answer and I didn't ask.
There was one other program I wanted to mention, and it was our Healthy Start program. It's another federal funded program that we have where we've been able to significantly reduce the infant mortality rate of the women that we serve. We're one of 5 Healthy Start programs within Ohio, one of 100 within the nation that has this grant. And we serve at least 250 pregnant women each year, and we monitor up to 80 different components of their health care. And the results have been overwhelmingly successful. And our hope is to continue to do that for the future. And that service is available at the Center for Women's Health.
Okay. And again, they can get access to your services. I'd like, please, for the staff to put up the screen that has the contact information for Five Rivers. It has Kim's information directly on there and phone numbers so that anybody who didn't catch the phone number when we gave it earlier can see it now. So that final slide is up. So again, closing remarks.
Well, I think that, again, we appreciate the opportunity to get the word out and to spread the word. I don't think a lot of people in the community are familiar necessarily with Five Rivers Health Centers, and we want to do a better job of sharing our programs, our services, the benefits of being a Five Rivers patient.
Wonderful. That's great. Thank you very much for coming on tonight and accomplishing a lot, I think, that we've covered about the programs of Five Rivers. And I didn't hear anything that was left out. But for the future, I know you'll be planning and working to continue to add more programs. Thank you very much to the viewers for watching the program. Good evening.